Hi there everyone, my name is Prerak Juthani. I'm an internal medicine physician at Stanford, and today I'm going to talk about the importance of ultrasound and clinical practice, part 2. In the previous video, I actually just talked about the importance of point-of-care ultrasound, and the reason for that is it adds another data point to a very convoluted patient. And patients are more than just their history, they're definitely more than just their physical. And now with ultrasound, we can physically look at any sort of organ that we're worried about, including the heart, lungs, and abdomen, and see if there's anything else going on. It's another data point that is just absolutely critical for patient care. So today, instead of focusing on just the importance of ultrasound, I'm going to be focusing on how you can learn ultrasound and how ultimately you can get better at it. Of course, am using Butterfly, and that's the ultrasound I've used throughout my residency, and that's the reason I'm working with them to make this video. I'm not being financially compensated for this video, but both the company and I agree that ultrasound is a very important tool that more and more residents should be utilizing because, one, it carries very little harm to the patient. It's just the discomfort of putting gel on, but there's no radiation associated with it, and it gives you a perfect look at some of the body's most magnificent organs. So, with that being said, for those of you who don't know, what is Butterfly? Well, Butterfly is this lovely probe right here. This is their new model, it's the IQ3, and it connects directly to your phone. When it connects to your phone, you will be able to see the images when you put it on your patient's chest or in wherever organ you want to see. Unlike traditional ultrasounds, this Butterfly ultrasound just uses one transducer for every single thing. So you can look at the heart, you can look at veins, you can look at arteries, and you use the same probe for all of them. The image quality is quite spectacular, and the good part is you can carry this around by yourself instead of carrying around a big machine with multiple different probes. I love this aspect of it because the best way to get better at ultrasound is to do scans all the time. It doesn't matter if it's just a regular patient visit. The more scans you do, the better you'll get at getting good at specific images. And the best way to do more scans is to have an ultrasound easily accessible to you. If you don't have an ultrasound accessible to you, that's one of the biggest reasons why people don't scan. So if you have this ultrasound, you can scan and it allows you to get images like these. I went over these in the previous video. But as I said, if someone coming in with chest pain, you put this on their chest, you can get a great look at their heart. If someone's coming in with belly pain, you can take a look at their bladder and make sure they're not retaining. And this new ultrasound even has a feature that allows you to calculate bladder volume, which is fascinating. And similarly, if someone's coming in with shortness of breath, you can use ultrasound to look at the lung. You can look at every single organ, and one of the biggest barriers that I've seen get in the way of people being able to be proficient in ultrasound is not having access to one. But having one right in your bag really changes the game. With that being said, let's now talk a bit about why I particularly think the Butterfly, specifically the IQ3, can be really helpful for residents. The first part is that it's very portable. I literally carry this around with me either in my coat or in a bag, and that bag comes with me everywhere. Whether that I'm going to the ED, whether I'm going back to the floor to see a patient, or even if I'm just going to the cafeteria, I bring this with me because you never know if and when a patient might become acutely hemodynamically unstable. The second reason I like this is because it plugs into my phone. The phone is so easy to carry around. I have my phone with me all the time too. So when you have your phone and you have this probe, you're pretty much always ready to make sure that you can address whatever's going on with the patient. I can't tell you how many times I've showed up next to a patient's bed and they're acutely hypotensive or something's wrong. Just having this with me ready to go makes it so much easier to make decisions on the fly. I will say, obviously ultrasounds are very expensive, but I personally think the Butterfly comes at a much lower price point than many of the other ultrasounds out there, and I think it is important to consider that. And sometimes they usually have discount codes for residents and trainees. Lastly, there is an educational tool that comes with ultrasound that I'm going to be talking about in this video. Specifically, Butterfly makes a bunch of educational content that I have utilized to get very good at it, and I feel really grateful because our residency actually made this content accessible for us, but I think anyone should be utilizing videos to really help them get better. At the end of this video, I'm going to be talking about another tool that will also show you the importance of practice and getting feedback. So I told you already, my personal favorite is the educational content through Butterfly. Here are some of the educational contents that they have. They actually physically will show you different types of videos. They have ways to scan for DVTs. They have ways to scan for cardiac. They even have the ways that you can break things down. So if you wanted to look specifically at cardiac views, these are all the different cardiac views here. But if you wanted to then learn about a different organ, they have different videos. And they have this other thing that's known as ScanLab. ScanLab is something I'm going to be going over very shortly, but ScanLab allows you to practice and allows you to see different annotations within the same screen. So let's talk now a bit about that. What is ScanLab? A ScanLab is a separate application. It's actually more on a tablet, so it's not even available on the iPhone. But if you have a tablet, the ScanLab allows you to practice and get feedback from a quality indicator. And there's also AI that labels the image for you. So let me show you this. Check this out. So with ScanLab, when you put the probe on the patient's chest, it tells you exactly where to put it. And once you put it there, it actually labels everything. So this is left atrium, mitral valve, left ventricle, aortic valve, and outflow tract. So this is one of the best ways I think you can learn is by physically putting it on your chest or a patient's chest, and then this ScanLab actually tells you positioning and gives you AI reasoning as to how you can improve it. So hopefully in this video you've learned the importance of point-of-care ultrasound, the fact that you can utilize it alongside your history and physical exam to make critical decisions for patients, and the last thing is nothing ever happens on its own. You really do have to practice, and one of the best ways to practice is by watching videos and physically scanning and getting real-time feedback. So I hope this was helpful for you. I personally have benefited greatly from this, and I hope that more and more people start utilizing ultrasound and find it as fascinating as I do. Thank you so much for watching. Bye.